Understanding COVID-19, Guidelines for Faculty and Staff, updated December 18th, 2020. Introduction. COVID-19 is a disease caused by a respiratory virus first identified in Wuhan, Hubei Province, China, in December of 2019. COVID-19 is a new virus that hasn't caused illness in humans before, but has resulted in thousands of infections causing illness, and in some cases death worldwide. The best practices for reopening recommends educating the campus community on COVID-19 and how they can prevent and protect themselves and others, which is the goal of this presentation. Agenda: General COVID-19 overview. Signs and symptoms. What to do if you are sick. Prevention measures. Campus-specific policies and practices, and resources. Signs and symptoms. Symptoms can range from mild to severe. Older adults and people who have severe underlying medical conditions seem to be at higher risk. Symptoms may appear 2 to 14 days after exposure to the virus. Individuals may test positive and be asymptomatic. People with COVID-19 have reported a wide range of symptoms. The list below does not include all possible symptoms. Symptoms could be fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. What to do if you are sick. Stay home except to get medical care. Call ahead before visiting your doctor. Separate yourself from others. As much as possible, stay in one room. Monitor your symptoms. Cover your coughs and sneezes. Wear a face covering. Clean your hands often and high-touch surfaces frequently. For more information on what to do if you are sick, visit the link provided to the CDC site. How to prevent the spread. Everyone should wash hands often, using soap and water or at least a 60% alcohol-based sanitizer. Avoid close contact. Social distance by staying at least 6 feet apart. Cover your mouth and nose. Wear a face covering and practice proper cough and sneeze etiquette. Clean and disinfect. Wipe down high-touch surfaces at least daily. Monitor your health. Stay home when you are sick. Testing. Most primary care providers have the ability to test or can refer an individual to a testing location. When seeking a test, it is recommended to get a PCR test over a rapid test unless you are symptomatic. You should quarantine until your test results are received. A list of testing sites for Garrett County and the surrounding area is available on the college's COVID resource page, available at the link provided. Campus-specific policies and practices. Properly worn, CDC-recommended face masks or coverings are required when on campus and interacting with others, and outdoors when social distancing cannot be maintained. Employees and students are required to complete a daily self-screening before coming to campus. Social distancing, maintaining 6 feet from other individuals, is highly encouraged when appropriate. Have you tested positive or been exposed? You should immediately notify the college and isolate or quarantine at home until you are cleared to return to campus. Are you an individual at high risk? See the ADA Reasonable Accommodations Process and Form available on the HR intranet page. You should abide by any other practices implemented by the college. See the college's Laker Strong plan for more information. Help counter stigma and promote resilience on campus. Mental health services are available during this stressful time. Remember, we are all in this together. To help control the spread of COVID-19 on our campus, you should report to the Office of Equity and Compliance a positive COVID-19 case, you have been identified as a close contact, you suspect you have been exposed, or you are experiencing symptoms. Reporting can be done by emailing equitycompliance@garrettcollege.edu or calling 301-387-3037. Isolation or quarantine guidelines are handled on a case-by-case basis. The "When Can I Come to Campus" document helps outline different situations regarding isolation or quarantine. Facility practices. We have increased cleaning protocols on our campus. Implemented best practices that you should take note of are that employees will be responsible for keeping their workspaces clean and free of clutter, and are also responsible to remove the trash from their office and place in a common receptacle in the building hallway at least once a week. Other safety measures implemented include reduced classroom occupancy, the installation of protective barriers, and guidance for specific areas and actions. All of these details are outlined in the Laker Strong Plan. Here you'll find a slide of resources to educate yourself more about COVID-19 and the college's response. Thank you for your time today. Should you have any questions, please feel free to contact the Office of Equity and Compliance.